There are two muscles in the lateral compartment of the leg. They are the fibularis longus and fibularis brevis. They both attach to the lateral shaft of the fibula, run distally down the leg, and then go posterior to the lateral malleolus of the fibula. Because they are in the lateral compartment, they are everters of the foot, which is this action. Because they run posterior to the lateral malleolus, they are both plantar flexors of the foot as well. Here we can see their tendons engage. The fibularis longus begins proximally at the head of the fibula and the proximal lateral fibular shaft, and it runs distally down to go behind the lateral malleolus. We can ask the client to evert her foot, and we can strum across this muscle perpendicularly. We begin the palpation proximally, and then we can continue in baby steps running distally down the muscle, as we see here. Right around here, the fibularis longus becomes tendon. It is usually visible proximal to the lateral malleolus if we ask the client to evert. Here is the fibularis longus tendon proximal to the lateral malleolus. To find the fibularis longus tendon distal to the malleolus, we have to palpate here. We cannot see it, but you can see me strumming it right here. The fibularis longus distal tendon then dives around the cuboid and travels very deep within the plantar foot to meet the tibialis anterior tendon at the medial foot at the first metatarsal and first cuneiform. The fibularis brevis starts in the distal half of the lateral fibula and is deep to the fibularis longus. Because it has the same actions as the fibularis longus, and the fibularis longus overlies it, it is extremely challenging to discern these two muscles from each other. But as the fibularis longus narrows to a tendon, we can see and palpate fibularis brevis on either side of the fibularis longus. Here it is on the anterior side, and now here it is on the posterior side. The fibularis brevis tendon goes deep to the fibularis longus tendon and then comes out from underneath it on the distal side of the malleolus and is often visible in the foot here. If it is not visible, it is usually palpable. It then attaches to the styloid process of the base of the fifth metatarsal of the foot.